Hello guys, it's your girl Rebecca, and today we are doing a fun thing. I am going to be trying the 23andMe kit. It does, the one I got is the health and ancestry kit. This kit costs $169. It was on sale. It's normally like $200, but they also just have the one that's the ancestry kit, where you get to learn about your ancestry and what you are. But I got the health one. The health one will tell you diseases and conditions that you are prone to get, and it will also tell you diseases, conditions, and chromosome conditions that you can pass on to your children, like traits and things. So let's get started and open this up. I am so excited. I ordered this kit, I would say maybe 2-3 days ago, and I got it today, and it's just a really fun kit. You do have to pay taxes on this, so we are going to follow the instructions on how to do this. And I have my other tablet here because I have to register this kit. It says here, number 1, go online to 23andme.com/start to register your saliva collection tube using the barcode, so we know it belongs to you. We cannot process your sample unless it is registered. So we're going to open this up here. And see. So let's go on 23andMe. Let's go on 23andMe. So this is 23andMe. This is what the website looks like. And there's 2 kits that you can get. And there's this. Whoops, no, didn't want to do that. There's that kit. No. Hold on a second. Let me take this kit off. Okay, so there's 2 kits that you can get, and I'm the one that got that kit, which is $169, and it's normally $199. So we want to register the kit, and let's see how you open this, because I do not want to, like, okay, we need to register your kit. So I need to fill this section out. So my email, do my email, I hope everyone is doing well today. Then I'm going to do my first name, and then my last name, and then my birthday, and then the day I was born. I mean the year that I was born. And then now I'm going to accept the terms, and then I need to set an ISO, and then I want to sign up. Whoops, it didn't take that. CRIMA. Okay, it says verify your email. We just sent an email. Okay. And it says we need to verify that this email address belongs to you. Okay, so I need to go there to my email. And I need to go to my email. Okay, and it says right here, I have tons of emails, but it says right there, 23andMe notification. I want to hit that. And then it says verify your email. So I want to verify my email address. And now I need to set up my password and all that. So, and sorry about the background noise. That's my mom on the phone. She knows I'm recording, but she wants to do this crap all the time to me. And it's really annoying. And I told her to wait till I got done with this video to do her phone calls. Okay. 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 Well, they do match. Let's try this again. Let me redo my thing. Okay, now it got me to the next section here, and it says enter your barcode. Who will be using this kit? I will be using this kit, or someone else will be using this kit. I will be using this kit. So we're going to open this up. I'm so excited. I'm just so excited. And it has like this. It says, hi, let's get started. And it says write down your 14-digit barcode, which I have to get a pen to write it down. And it says here, we are excited for you to begin this journey. And we want you to know we are here to help. Whether it's questions about our service or how to get started, we have resources available to you. And then it has like the number. So, here is the little kit. And it comes with a spit cup, a biohazard thing, and stuff like that. Okay, it says no food or drink for 30 minutes. Okay. Close funnel, detach. So I may have to wait a little bit before I do this because I did eat, but I think it's been 30 minutes. So we have a little pamphlet here. Because I did drink something. It says, do not eat, drink, smoke, or chew gum for 30 minutes before giving your saliva. Do not remove plastic film from the funnel lid. Spit into the funnel until the amount of liquid saliva, not bubbles, reaches the fill line shown in picture 2. So we spit and it goes to picture 2. Okay, so let's register the kit here. Here's the funnel thing. And then it has like a little barcode right here. So we need to register this. So I'm going to hit it and put in the numbers that it says. Okay. 1377. And then 3216. Okay, so I put in the numbers, and I will be using this kit, and I'm a female. Continue. Consents. I have to consent to this. My name. I accept. Okay. I am this person. I have read this document, or I am legally authorized to give consent. Okay. I am this person. I do give consent. Hit that. Thank you for agreeing to participate in 23andMe. I am this person. I have read the document. I am legally authorized to give this consent. It says consent document for sample storage and additional genetic analysis. It says yes. Okay, yes, store the sample, or no, do not store the sample. It says by choosing to have 23andMe, store either your saliva sample or DNA extra for your saliva. You are consenting to having 23andMe and its contractors access and analyze your stored saliva. Yes. And now review and submit. So I'm going to just make sure that this code is right. Okay. Has my name, my birthday, and I'm female. And I'm going to put submit. And it's going through. Your kit has been registered. We'll send you an email confirmation with your barcode and profile name. Here's what's next. Provide your sample. Spit. Check out tips providing your sample. And then it says complete your profile. Tell us about yourself, set your preferences, and answer some questions about your health. Okay, so we are going to do that to get started. It says choose your health reports. Our health reports provide information about genetic risks for health conditions that could be relevant for you, your children, and potentially other family members. Deciding whether or not you want to learn about these risks is a personal choice. Keep in mind that our reports do not diagnose any health conditions. If you click I do, you will receive genetic health risk and carrier status reports. Some of these reports, for example, the report on late onset Alzheimer's disease, will require you to make an additional choice on the next screen. It says, would you like to receive your health reports? And it says, I do want to receive my health reports. I do not want to receive my health reports, or ask me again later. And I'm going to hit I do, and this is what it looks like. Continue. Choose your health reports. The reports below are about serious diseases that may not currently have an effective treatment or cure. If you tend to feel anxious or have ever been diagnosed with anxiety or depression, you may have more emotional difficulty with these reports. Also consider having a risk variant does not mean that you will definitely develop the condition. Knowing or telling others about your genetic risk could affect your ability to get some kinds of insurance. Genetic testing for these conditions is not currently recommended by the healthcare professional organizations. The Alzheimer's Association, a patient advocate group, also does not recommend genetic testing for Alzheimer's disease in the general population. If you decide to view these reports, your reports will provide information about resources that may be helpful, including support groups, genetic counseling, and how to discuss results with family. And it says here, would you like to receive the following reports? Late onset Alzheimer's disease report? Yes. Parkinson's disease report? Yes. And again, it asks you questions. And I'm going to hold my foot to sleep. And I'm going my foot. I'm going to push continue. It says configure your reports. We need a bit more information from you, including your ethnicity and sex, to customize the interpretation of genetic results. This information is not used to compute your ancestry results. Okay. Configure your reports. In what country and postal do you live? Okay, I have to put the state that I live. Oh no, the country, sorry. United States. Then you put in your zip code. Woo, my foot to sleep. Are you Hispanic or Latino? No. What is your race or ethnicity? American Indian or Alaska Native, Middle Eastern, white or European, black, African or African American, Native, Hawaiian or other. I am white. Okay, and it says here, what best describes your white or European ancestry. Please check all that apply. Western European, Southern European, Northern European, or Eastern European, other, or I'm not sure. I'm not sure. I'm not sure. Do any of the following cultural group labels describe your ancestry? Please check all that apply. Turkish, French Canadian, Amish, Jewish, Cajun, Mennonite, I'm not sure, or none of the above. Should I put none of the above because I'm not... I just put I'm not sure. Okay, it says survey complete. Your answers allow us to personalize many of your reports. Go to last step. Okay, I'm hitting the button to go to the last step. Last step, complete your health profile. Most people finish the survey in 10 to 20 minutes, and your data will always be kept confidential. Okay? We're filling this out, and then I can do this because it'll be 30 minutes. Would you say that in general your health is excellent, very good, fair, or poor? I'm just going to put fair. Have you smoked at least 100 cigarettes in your entire life? No. During the past 2 weeks, while at home or at work, how often were you exposed to tobacco smoke from other people? Never. In the last 2 weeks, how many servings of alcohol did you drink each day? None. Because I don't drink. What is your height? I'm 5 foot 5 inches. So I'm 5'5". What is your current weight? I'm gonna put 176. What is the most that you have ever weighed? What is the most that you have ever weighed, excluding periods within a year or giving birth? Your best guess is fine, and it might be the same as your current weight. What is the most that you have ever weighed? 230 pounds. Like, I weighed like 230. Okay. How old were you when you were last at that weight? I think, how old was I? I'm thinking 24, I think. 24, okay. Are you naturally a night person or morning person? It says morning person, night person, neither, it depends, or I'm not sure.
You don't have to send that back?
Huh?
You don't have to send that kit back?
Yeah, I'm answering questions though.
Oh, okay.
Are you naturally a night person or morning person? I like mornings better. In a typical week, how many times do you participate in any physical activities or exercise, such as running, golf, biking? Never. I don't exercise. It says, on a typical day, how many servings of fresh or cooked vegetables do you eat? 1 serving equals about a half a cup. Well, I haven't been eating any vegetables recently. Yeah, I haven't been eating vegetables. So I guess not at all.
Once a day she eats.
No, but it's asking me how many. Okay, I'm not sure. I just put not at all. I don't know. I'll probably get like a bad report saying that. It says, during a typical week, how often do you eat red meat? I haven't been eating red meat. I normally eat chicken. I'm gonna put less than once per week. Yeah, because I don't. Have you ever had general anesthesia for surgery? Yes. Have you ever been diagnosed with or treated for any of the following conditions? Lupus, Sjogren's syndrome, or allergies? Have you ever been diagnosed? Yes. Have you ever been diagnosed with or treated for lupus? No. This is fun. Have you ever been diagnosed or treated for this one really, really long syndrome? No. Have you ever been diagnosed with or treated for allergies? Yes. How old were you when you first were diagnosed with an allergy? 10 or 11? I'll put like 10. Because I had allergy shots growing up. I had allergy shots. It says, have you ever been diagnosed with or treated for any of the following conditions? Multiple sclerosis, clinically isolated syndrome of the brainstem, or immunodeficiency or reduced immune response. I always would get sick when I was little. Is that an immunodeficiency or reduced immune response? I'm not sure. Clinically isolated syndrome of the brainstem. I have no clue what that is. I'm not sure. Have you ever been diagnosed or treated for MS? No. Have you ever been diagnosed or treated for the CIS or CISB? I'm going to put no, because I don't know what that is. I have a brain injury. Have you ever been diagnosed with or treated for an immunodeficiency or reduced immune response? Hey, Mom. Have I ever been diagnosed with or treated for an
Wait a minute, I can hear. Have you been diagnosed with what?
with or treated for an immunodeficiency or a reduced immune response?
No.
Okay.
Well, that means that your cells don't fight diseases.
Yeah, I don't think I have.
Well, yeah, because when you were born, you didn't have, you were like an aged patient that doesn't have your things to fight off diseases. Would that be considered that?
I don't know.
Because that's what you have. You have that because you don't get over well. It takes you longer to...
I guess I could put yes.
Yeah, I guess.
Okay, it says, have you ever been diagnosed with or treated for any of the following conditions? Diabetes, gestational diabetes, or high blood sugar, any type of thyroid disease or non-thyroid cancer, or high blood pressure? Yes. Which was your immunodeficiency or reduced immune response caused by any of the following? Genetic or congenital, medication such as chemotherapy or steroids, organ or tissue transplant, another chronic disease or infection. My doctor never found or mentioned a cause. Well, I had VRE. And that was a chronic infection, because VRE was a chronic infection. But I'm going to... chronic disease or infection. Yeah, I had VRE. That's a chronic infection. Tell us about your lifetime history of infection. Please select all that apply. 2 or more serious sinus infections or cases of pneumonia within a single year. Need for intravenous antibiotics to successfully treat infection. 4 or more new ear infections within a single year. Recurrent deep skin or organ abscess. A family history of an inherited immunodeficiency, persistent thrush in mouth or elsewhere on skin, 2 or more months of antibiotics with little effect, 2 or more serious persistent infections. I had that one and that. Okay. How old were you when you were first diagnosed with an immunodeficiency or reduced immune response? Since a newborn? Was a pre-me. Oh, my foot's asleep, guys. Whew. Your response is not valid. Please enter. It's a whole number between 1 and 100. Okay, I guess I put 1.
I wonder
Because I was a newborn and I was born a preemie, so I was born a preemie. So I've always had problems healing and stuff. Have you ever been diagnosed with or treated for diabetes? Yes. Have you ever been diagnosed with or treated for any type of thyroid disease? Not cancer? Yes. But I don't take thyroid meds anymore because my thyroid works fine now, but I was, so. Have you ever been diagnosed with or treated for high blood pressure? Like when I don't take my heart pill, my blood pressure can be high. because I have heart problems, so I'm going to put yes. What type of diabetes were you diagnosed with? Type 2. What treatments have you ever been prescribed for diabetes or high blood pressure or high blood sugar? Diet and lifestyle changes, glucophage or metformin, insulin, and other medications. In the first 12 months after you were diagnosed with diabetes, what treatments were you prescribed for diabetes? At that time, I was just on glucophage. And then diet and lifestyle changes. In the past 12 months, what treatments were you prescribed for diabetes? Glucophage, other medicine, and insulin. What? Yeah, I have insulin. In the past 12 months, what type of insulin have you used? Intermediate acting meant to work in 1 hour and last 6 to 12 hours. Long acting meant to work in 2 hours and last 24 hours. Or rapid acting meant to work in 15 minutes and last a few hours. I really am not sure. Let me go get my insulin pen. I'll be right back, guys. I'm going to get my insulin pen and see. I'm on Novolog. And I use it 4 times a day. I think the Novolog, it works within 15 minutes. I think it's a rapid acting, but I'm not really sure. In the past 12 months, how many different kinds of prescription medications have you taken for diabetes, not including insulin? Glucophage or metformin? Well, I only take one other medicine besides those 2. So it's just 1. Have you ever been tested for hemoglobin A1C level? Yes. What was your highest ever hemoglobin A1C? It was higher than 6.4%. How old were you when you were first diagnosed with diabetes? How old was I? I know I was in my 20s. So my accident happened when I was 23. So I'll say around 23. Okay. This is fun, guys. It says, have you ever,
Did you feed Sam while I was gone?
No. Have you ever been diagnosed with or treated for an eye condition related to diabetes? No. Have you ever been diagnosed with or treated for any kidney problems? No. Have you ever been diagnosed with or treated for any nerve problems related? Yes. What type of thyroid condition were you originally diagnosed with? I think it was low. It was low. Underactive thyroid because it wasn't high. If it was high, I would have lost weight. But it's the one when you gain weight, so I believe I was low. What type of thyroid disease have you been diagnosed with? Graves' disease, Hashimoto's, thyroiditis, thyroid nodulars, toxic adrenal. Like, I know, like, when they did an ultrasound on my thyroid, they found, like, little, like, cysts on them, and that went away, so I'm not really sure. What treatments have you been prescribed for the thyroid condition? I don't have thyroid condition anymore, but I was on, at the time, the pill. How old were you when you first was diagnosed with thyroid? I think 16, 17. This was 17. But now my thyroid's fine, so. Has your doctor ever told you that your high blood pressure was mainly caused by the following? Kidney problems, adrenal gland tumors, obstructive sleep apnea, thyroid problems, problems with blood vessels, including arteries, I have cardio, myopathy, and PVCs. I just put cardiomyopathy. It won't let me put yeah, I can put that. I just didn't have the thing marked. Okay. How many medications are you taking currently to control your blood pressure? 1. Which is my correct. Have you spent the night in the hospital for... No. How old were you? 23. This is fun, guys. Have your cholesterol levels been tested? Yes. What was your highest level? I'm not really for sure what my highest level was, but I'm going to put maybe 200-239 milligrams, because I'm really not for sure because I've never really seen my results. I'll do that one. What was your highest ever LDL? I don't know. I'm not sure. What was your lowest HDL? Your good cholesterol. Oh, my bad cholesterol? I'll put that. My good cholesterol. I'm not sure. What was your highest ever triglyceride level? I'm not sure. How old were you at the time of your highest ever total cholesterol measurement? I guess I'll just put 23. Because I started having problems after my surgery, and that was when I was 23, and I had problems. Have you ever been prescribed medications to lower your cholesterol, such as statins? Well, I take Coreg, but I can't remember if that's a statin. I don't think it is. Oh, yeah. Lipitor. I was taking Lipitor. Have you ever been diagnosed with or treated for any of the following conditions? A heart valve condition, cardiomyopathy, which is a weak or enlarged heart muscle, heart failure? Yes. Have you ever been diagnosed with or treated for a heart valve condition? Not heart valve. No, not that I know of. Have you ever been diagnosed or treated? Yes. For cardiomyopathy? Have you ever been diagnosed with or treated for heart failure? Yes. Have you ever been diagnosed with or treated for an aneurysm? No. What type of heart muscle problem, cardiomyopathy, were you diagnosed with? Expanded dilated heart chambers, rigid restrictive heart muscles, a thick, bulky, hypertrophic heart muscle. I think it's my left side is bigger than my right side. It's bigger. I had expanded, dilated heart chambers, but then at the same time, my heart muscle became big. That and that, but it won't let me do both. Thick, bulky, hypertrophic. I know because of all the blood products I had, it made my heart enlarge. I'm just going to do the expanded, dilated heart chambers. I don't know. Did your doctor tell you that your cardiomyopathy was mainly caused by any of the following: heart blood pressure, heart valve problems, congenital heart attack, or blocked heart arteries, irregular heartbeat, hemochromatitis, chemotherapy, radiation, other medications, alcohols and drugs? Well, it's because I lost all that blood. I had an irregular heartbeat. This is hard. I'm just going to put I'm not sure because I really don't. I just know ejection fraction is the percent of blood in the heart that is pumped out with each heartbeat. What was your lowest? My lowest was less than 35%. That was my lowest because my heart was only working at 20-something%. Have you had a blood test for BNP, which is brain natriuretic peptide, or in? I probably did. But I'm not sure. How were you when you first? I was 23. Everything's 23. How were you when you're first diagnosed with heart failure? 23. Some of these questions are hard. Have you ever been diagnosed with or treated for any of the following conditions? Coronary artery disease or coronary heart disease, carotid artery disease, peripheral artery disease, heart attack, or irregular heartbeat? Yes. Have you ever... No. No. Have you ever been diagnosed with or treated for peripheral artery disease? No. No. Have you ever been diagnosed or treated for irregular heartbeat? Yes. What type of irregular heartbeat, cardiac arrhythmia were you diagnosed with? Ventricular tachycardia, bradycardia, ventricular fibrillation, long QT syndrome, Wolff Parkinson White syndrome, arterial fibrillation, or flutter. PVC, which is premature ventricular fibrillate. No. Ventricular contractions. There. It's hot. How were you when you were first diagnosed with an irregular heartbeat? 23. Have you ever been diagnosed with or treated for any of the following conditions? Raynaud's disease or I can't even say it. Myocarditis, inflammation of the muscle part of the heart, stroke? No. Have you ever been told that you were born with heart defects? No. Have you ever been diagnosed with or treated for any of the following conditions? Macular degeneration, optic neuritis, retinal vein occlusion, or cataracts? No. Have you ever been diagnosed or treated for the following conditions? Dry eyes or DES, glaucoma, inflammation inside your eyeball? No. Have you ever been diagnosed with anemia, antiphospholipid syndrome, a blood clot condition causing repeated blood clots, a bleeding disorder or bleeding tendencies, or hemochromatosis? Yes. Yes. For anemia. Have you ever been diagnosed with or treated for no. Have you ever been diagnosed with or treated for a blood clot? Yes. Have you ever been diagnosed with or treated for a bleeding disorder? No. Where is it? Have you ever been diagnosed with or treated for hemochromatosis, which I don't know what that is. Did your doctor tell you that your anemia was mainly caused by one of the following? Hormonal changes, blood loss such as from an ulcer or injury, inherited anemia, autoimmune immune hemolytic anemia, iron and vitamin deficiencies, bone marrow conditions, medications, other okay. It's hot. It's probably this light right here. How old were you when you first were diagnosed with anemia? What type of blood clot were you diagnosed with? A clot in your lungs, a clot in your arms or legs, a clot in my leg. Did the doctor tell you that your blood clotting condition was mainly caused by the following: a blood clotting disorder, surgery or injury, prolonged immobility such as bed rest? It was from a surgery. How old were you when you were first diagnosed? Have you ever been diagnosed with or treated for any of the following conditions: acid reflux or gastroesophageal reflux, irritable bowel syndrome, colon polyps, celiac disease? Yes. Yes. Yes, yes. No. 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 My feet are asleep, guys. Says, did your doctor recommend that you take any of these medications for 8 weeks or longer? Prilosec? Yes. Have you ever been diagnosed with Barrett's esophageal? No. What type of irritable bowel syndrome were you diagnosed with? IBS with predominantly loose or watery stools, IBS with hard and lumpy stools, IBS with mixed diarrhea and constipation. What treatments were you prescribed to treat irritable bowel syndrome? Medication for anxiety, medication to reduce cramping, medication for diarrhea, dietary changes, no treatment. I don't have treatment. I'm like saying I'm sweating. I'm hot. Have you ever been diagnosed with or treated for the following conditions: Crohn's disease, ulcerative colitis, or indeterminate? No. None of them. Haven't been diagnosed. Have you ever been diagnosed with or treated for any of the following conditions: chronic gastritis or stomach ulcer, pancreatitis, fatty liver disease, cirrhosis, or any form of hepatitis? No. In the past 12 months, have you had a blood test for liver function enzymes? Yes, I just got it done, but I don't know the results. Was the results of your most recent test for liver functions or enzyme? I'm not sure because I haven't got the results. Were your aspirate aminotransferase AST or SGOST levels elevated in normal range? I don't know. I don't know. Were you alien? I'm not sure. Have you ever been diagnosed with or treated for any of the following conditions? Arthritis, gout, something, or low bone density? Yes, arthritis. Have you ever been diagnosed with or treated for gout? No, but I know my dad has gout. Have you ever been diagnosed with or treated for that? No. Have you ever been diagnosed with or treated for low bone density? No. What type of arthritis have you been diagnosed with? Caused by wear, trauma, or injury. I probably have osteoarthritis because that's in my back, in my lower back. Have you ever regularly experienced stiffness in the morning that improves with activity? Sometimes. I guess yes. Did your doctor perform an X-ray, MRI, or CT scan diagnose you? Yes. Have your doctor ever recommended joint replacement surgery for your arthritis affected joints? No, because I don't have it in my... Have you ever had joint replacement surgery? No. I'll say 17 because I had a first back surgery. Whew, it's getting hot in here, guys. Have you ever been diagnosed with or treated for any of the following conditions? Chronic fatigue syndrome, carpal tunnel syndrome, chronic pain? Yes. Not chronic fatigue syndrome. Not carpal. Yes, for the chronic pain. Fibromyalgia, no. How long has your chronic pain last? Longer than a year. It's been 18 years. What treatments have you been prescribed for your chronic pain? Over-the-counter pain medicine, prescription pain medicine. Was when I was 15. Because then 17 I had back surgery. I'm burning up, guys. This light, ugh, is making me hot. But if I don't have it, you can't see me. Have you ever been diagnosed with or treated for any of the following conditions? Paget's disease, giant cell. No, haven't been diagnosed with any of those. Have you ever been diagnosed with or treated for any of the following conditions? Anxiety, attention deficit, yes. Eating disorder, depression. Have you ever been diagnosed or treated for anxiety? Yes. Have you ever been diagnosed or treated for generalized anxiety disorder? Yes. Have you ever been diagnosed with or treated for attention deficit disorder? Yes. Have you ever been diagnosed with or treated with bipolar disorder or manic depression? I have major depressive disorder, but I don't have manic depression. Have you ever been diagnosed or treated for depression? Yes. Have you ever been diagnosed with or treated for a major depressive disorder? Yes. Have you ever been diagnosed with or treated for an eating disorder? No. 23. How old were you? 23. It's just asking me how old I was when I was diagnosed with all this stuff. Have you ever been diagnosed with or treated for any of the following conditions? Obsessive compulsive disorder, panic attacks, phobias, or schizophrenic? Yeah, OCD, because I had that when I was little. Have you ever been diagnosed with or treated for panic attacks? I'd say yes, because have you ever been diagnosed or treated for phobias? No, but I have phobias, but like, I don't like spiders. Have you ever been diagnosed? No, I'm not schizophrenic. Obsessive compulsive disorder. I was little. I'm gonna say 7. I don't really know. It sure is taking a long time. How old were you when you were first diagnosed with panic attack? Have you ever been diagnosed or treated for the following conditions? PTSD, autism, or Asperger's? Yes. Have you ever been diagnosed with PTSD? Yes. Which is post-traumatic stress disorder, if any of you guys know what it is. Have you ever been diagnosed with or treated for autism? No. Asperger's? No. PTSD, 23. This sure is taking a long time. Have you ever been diagnosed with or treated for any of the following conditions? Polycythemia vera, PV, essential thrombocythemia, ET, myelofibrosis, MF, chronic. No. Have you ever been diagnosed with or treated for any of the following conditions? Insomnia, narcolepsy, sleep apnea, or restless leg syndrome? See, my grandma Dill had narcolepsy. Treated for sleep apnea. I was treated for sleep apnea. I didn't have sleep apnea. Like, my oxygen level would drop, and I was on oxygen for a few years, but it's fine now. I'm just gonna put no. Have you ever been diagnosed? Yes. What treatments has your doctor prescribed? Prescription meds. This is fun to do, but they ask you so many questions. Like, if you just did the ancestry part, you wouldn't be answering these questions because this is for the health part. What treatments has your doctor prescribed for restless leg syndrome? It was prescription meds. Like, when I was coming off my pain meds, I was having restless leg syndrome. How old were you? Restless leg syndrome. I want to say 31. Have you ever been diagnosed or treated for sleep-wake disorder, rapid eye movement, sleep behavior disorder, or activity during sleep or nightmares such as sleepwalking, or acting out dreams? No. Has your doctor ordered a sleep study in which you spend the night at a lab? Yes. Have you ever been diagnosed with or treated for any of the following conditions? Alzheimer's, Parkinson's, epilepsy, or traumatic brain injury? Yes, I had a TBI because of the low oxygen, and I died. Have you ever been diagnosed with... No. 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 If I had seizures, I don't know. Yes, I don't have seizures. How old were you when you had TBI? I was 23. Because would be considered as a TBI because my brain had no oxygen. Have you ever been diagnosed with or treated for the following? Migraines, my myasthenia gravis, or muscular dystrophy? Yes, migraines. Yes. Have you been diagnosed with or treated? No. No. What treatments have you been used for migraines? It was Imitrex. There it goes. They had it. They had Imitrex. Woohoo! Imitrex worked, but the last time I had a migraine, it didn't work. Do you take a medication every day to prevent migraines? No. I only take a medicine if I have it. How old were you when you first diagnosed? Have you ever been diagnosed with basal cell carcinoma? Nope. None of those. Have you been diagnosed with hair loss? Yes. Hair loss. I'm losing my hair. So have you ever been diagnosed? No. I'm not saying all this stuff because the answer is no to them. What type of hair loss were you diagnosed with? Alopecia, hair loss over large part of the body, androgenic alopecia called male pattern. Well, it is because I'm losing my hair like that's going like this. Alopecia, hair loss in patches. I have it here and then I have it like on my side. It's like everywhere. I guess I'll do that one. I was starting to lose my hair when I was 11. Have you been diagnosed with vitiligo, rosacea, severe acne, HS, hives, or your... No. Leukemia, Hodgkin lymphoma, non-Hodgkin? No. Have you ever been diagnosed with or treated for any type of cancer? No. Have you ever been diagnosed with asthma, COPD, bronchitis, idiopathic pulmonary fibrosis, or cystic fibrosis? Yes. Have you been, yes. Have you ever been diagnosed with or treated for COPD, chronic obstructive pulmonary disease? Yeah, because asthma is COPD. So asthma is like COPD. Have you ever been diagnosed with or treated for bronchitis? Yes. That one's a no. Have you ever been diagnosed with or treated for cystic fibrosis? No. Have you ever been prescribed medications for asthma? Yes, I have been prescribed a nebulizer. I've been prescribed medications and a nebulizer. During the last 12 months, how often have you used your quick relief rescue inhaler to treat asthma attacks? I used it the other day. Okay. How old were you when I was diagnosed with asthma at 11? Have you experienced an episode of an asthma or asthma attack over the age of 18 years old? Episodes of asthma or asthma attacks refer to periods of worsening asthma. Yes. What COPD-related conditions have you been diagnosed with? Emphysema, COPD. I'm going to put asthma. Did your doctor do a pulmonary function test in which you exhale quickly? Yes. Yes. What treatments did your doctor prescribe for COPD? Steroid pills or shots for flare-ups. I had steroids. I had oral medication. Actually, okay. Okay. Guys, I'm sorry this is taking so long. How old were you? They said this is only going to take 10 to 20 minutes, and it's been taking longer than that. Has your bronchitis ever lasted more than 3 months? No. Have you ever had multiple episodes of bronchitis within a period of 3 years? I'm not sure. During an episode of bronchitis, does your cough leave you short breath? Yes. During an episode of bronchitis, yes. How old was I when I was first diagnosed with bronchitis? I don't know. 10? I don't know. Have you been diagnosed with or treated for any of the following conditions? Chronic kidney disease, kidney stones, recurrent UTIs, at least 2 infections in 6 months, or 3 in 1 year, or a urinary condition such as incontinence, overactive? No. Have you ever been diagnosed with preeclampsia, endometriosis, uterine fibroids, or leiomyomas, or polycystic ovarian syndrome? Yes. Have you ever been diagnosed with or treated for infertility or subfertility? No. Have you ever been diagnosed with or treated for preeclampsia? No. Have you been diagnosed or treated for endometriosis? Yes. No. Have you ever been diagnosed with polycystic ovarian syndrome? I don't know about that one because I know I have endometriosis and sometimes I get cysts, but I don't think I have that. Have you ever been diagnosed with or treated for premenstrual syndrome or dysphoric disorder, PMS or PMDD? No. Have you ever been diagnosed with or treated for recurrent vaginal infections? No. Did your doctor do any of the following tests before diagnosing you endometriosis? He did surgery, and I believe he did a biopsy of my uterus. Have you ever had any of the following treatments for endometriosis? Prescription pain medicine, medications causing temporary menopause, over-the-counter pain medicine, other pills or shots containing hormones. I had surgery. When was I first diagnosed with endometriosis? I think I was like 27. Have you ever been pregnant? No. Have you ever been diagnosed with a bone fracture? No. In the past 12 months, have you received a flu vaccine? Yes. In the past 12 months, did you have a cold or flu? No, not cold or flu. Have you ever been diagnosed with or treated for any other conditions not yet mentioned? Let me think. No. What is your, now it's going to ask me different things. Now it's going to ask me what is my marital status. I've never been married. What is the highest degree or level of school you have completed? I completed I don't think it's an associate's degree. It was a certificate for nursing, and it's not on here. I'm just going to put that. What is the highest degree or level of school completed? What is the highest degree or level of school completed by the man who served? Oh, wait, hold on. By the woman who served as mother while you were growing up. My dad had... What was Dad's? He's an engineer. I think it's a master's degree. Hold on, guys. Let me go ask my mom. Hold on. Hey, Mom. Mom. What's the highest degree that Dad completed? It says there's associate's degree, bachelor's degree, a master's degree, a professional degree, 23andMe. Okay, guys, sorry, I had to go ask. It says, what is your primary interest in 23andMe? To contribute to the genetic research, to find out about my ancestry and genealogy, to learn about my biological parents or siblings, to find out about my health and health risk, to find out the traits and conditions my children could inherit from me, or to discover more about genetics in general. I want that one, but I want in that one. I want both. I'll just do that. Okay, now the survey is completed. Woo! Now we're going to push continue. Guess what? You've answered more questions than... It says, guess what? You've answered more questions than 30% of 23andMe participants. Thanks for your participation. And it says, introducing 23andMe research. Thanks for finishing the health provider service. By answering questions about health, traits, lifestyles, you help accelerate the pace of genetic discoveries. And then, next question. What is your resting heart rate? Resting heart rate? It's normally 100 and something. Have you ever noticed a peculiar odor when you pee after eating asparagus? I don't eat asparagus. Are you left-handed, left or right-handed? I'm left. Do you own a cat? No. Do you own a dog? Yes. How many times have you been pregnant? Never. How often do you suffer from back pain? Never or almost never. Occasionally, sometimes, fairly often, very often. Very often. Are any of your first-degree biological relatives, parents, siblings, or children allergic to peanuts? No. Have you ever been diagnosed with Tourette syndrome? No. Bleeding and blood clots. Have you ever been diagnosed with or treated for any of the following bleeding disorders? Hemophilia, von Willebrand, a clotting factor, an inherited platelet, No, I have never been diagnosed with these conditions. Have you ever been diagnosed with the following blood clotting disorders or conditions? No. Have you ever experienced any of the following blood clotting events? Deep vein thrombosis, which is the blood clot, a stroke, that, okay. Have you ever taken any of the following anti-blood clotting medications? Well, when I was in the hospital, they probably gave me Lovenox and heparin. Have you ever taken any of the following antiplatelet blood thinning medications? No. While on anti-blood clotting medications, were you diagnosed with a blood clotting? While on anti-blood clotting medications, were you diagnosed with a blood clot? No. How long were you? Less than 3 months. To the best of your knowledge, have you ever had an abnormal blood coagulation test? No. To the best of your knowledge, have you ever had a known plasma PT test? These questions are hard because when my surgery happened, yes, they would have been irregular, but do you bruise easily? Yes. How many nosebleeds have you had after the age of 12? I'm not sure. How many nosebleeds after the age of 12? That's none. Looks like you've answered the questions before. Is this still correct? Was your anemia diagnosed during or immediately following pregnancy? Wait, hold on. No, my anemia. Was your anemia diagnosed during or immediately? No. Have you ever been diagnosed with or treated for heavy menstrual bleeding? I haven't been treated for it, but I do have heavy. No. Have any of your first degree biological relatives been diagnosed with a blood clot event? I'm not sure. Continue. Okay. You've answered more questions than 49% of 23andMe participants. Why 23andMe is asking about blood clotting. It says, the blood clotting system normally works to help prevent bleeding. However, abnormal blood clotting can lead. There's more questions, guys. Do you think you perform better in a sprint or in a long distant race? Neither. I can't run. Oh, it says, do you think 40% of people says sprint race, 29% says long distance, 3% said both, and 28% said neither. It says, have you ever had the norovirus? Common symptoms include nausea, vomiting, abnormal pain. I think I did. Yeah. Have you ever been diagnosed with or treated for measles? No. Have you had influenza in the past 12 months? Common symptoms are flu and fever, over 100, muscle aches, chills, sweats, headache, dry cough, fatigue, nasal congestion, sore throat. I don't know. I could have had that because they said I had like a upper respiratory infection, but see, the one day my whole entire body was hurting and cramping and I had a fever. So I'm just going to put no. Have you ever had an elevated liver function test? No, I don't think. Over the past 3 years, have you frequently been told that your skin or your face looks older than your real age, 0 to 5 years younger than your real age, 5 to 10 years younger than your real age, or more than 10 years younger than your real age. People say I look like I'm in my 20s. I'll say 5 to 10 years. Woohoo! It says 34% of people said that they look 5 to 10 years younger than their real age. It says, how do you think the skin on your face makes you look compared to your real age? Older than my real age, it's like my... Well, that's a 0 to 5 years younger. Okay. Have you ever had the following weight loss surgeries? No. Are you red and green colorblind, if I can speak? No. Wood. Your lifestyle. Most people finish this survey in about 10 to 15 minutes. Oh my gosh, guys. I might just do my saliva test and then wait to answer all these questions. But this is how long it really takes. In a typical week, how often do you eat each of the following foods? Your best guess. Processed, cured, or smoked meat, including bacon, pepperoni, lunch meats, or hot dogs. I haven't been eating bacon. Like, I ate bacon that one week, but not in a typical week. I don't eat that stuff, but I'll just say 1 to 2 times a week. Pork? No, I don't. Pork is bacon, but I don't normally eat pork. Fish? No, I don't eat fish. Beef, lamb, or red meat? I haven't been eating that. Maybe I'll just do 1, 2. Chicken, turkey, or poultry. Ooh, I love that. I'll say 1, 2 weeks. Green vegetables. I normally do not eat green vegetables. I haven't ate any vegetables. Sweet or orange vegetables. Beans. Fruit. Candy, sweets, pastries, cookies, ice cream, or other desserts. Let's see. Nuts or nut butter. Drinks containing sugar, including juice, energy drinks, flavored tea, prepackaged frozen meals, fast food. How often do you consciously choose to eat less of the following meals or snacks? Calories. Always, most of the time, how often do you constantly choose to eat less? Sugar. Gluten or wheat. How often do you constantly choose? Something's in my hair. Starch, refined carbohydrates. How often do you constantly eat? It's just asking me all these questions like animal, dry food. This is hard. Choose to eat more of the following. Protein. To eat more of the following. Leave it green. How often do you consciously choose to eat more? Do you currently try to follow any of the specific diets? What is your waist size in pants? That's hard because I haven't measured myself. I don't know because I haven't measured myself. So I can't. In a typical week, do you regularly take any vitamin or minerals? No. In a typical week, how many days do you consider work days? Please enter 0 if you do not work. On a typical workday or weekday, if you do not work at what times of the day do you eat a meal or snack? On a typical non-work day or work or weekend day, if you do not work at that time. Some of these are tricky questions. Do you have an injury or disability? Yes. For how long have you had this injury or disability? In a typical week, do you do the following physical activities for at least 10 minutes? Vigorous physical no. On a typical work day or weekday, if you do not work, how many hours do you spend setting? On a typical work day, if you do not work, how many hours do you usually spend standing? On a typical work day, how many hours do you usually spend setting? How many hours of sleep do you get? What time do you usually go to sleep on work days or weekdays if you do not work? Do I go to sleep? I'll say 9 p.m. What time do you usually wake up? For today I woke up at 8. Sometimes I wake up at 5 a.m. I'll just say 7. On a typical non-work day, if you do not work during the past 6 weeks, how many hours of sleep did you get? What time do you usually go to sleep? I don't know. How many hours of sleep do you feel like you need to function? In a typical week, do you practice any of the following mind-body techniques for stress relief? For the next set of questions, please read each statement and then decide how much each applies to you in the past month. In the past month, please write how often I have someone who understands my problems. I have someone to talk with when I have a bad day. I have someone to help me if I'm sick in bed. There is someone around to help me if I need it. I get invited to go out and do things with people. Never. There are people around with whom to have fun. I have friends who will have lunch with me. Never I want, no. I feel that I am no longer close to anyone. Okay, in the past 6 months, was your participation in each of the following activities closest to daily, weekly, monthly, yearly, or never? Family or friendship activities outside the house. Church or religious activities such as services. Sports. Other recreation activities involving other people, including hobbies, bingo. Would you say that in general your health is how satisfied are you with your life? says, you've answered more questions than 59% of 23andMe participants. The BMI across the USA. West Virginia, Arkansas, Mississippi, and I believe that's Chicago are all overweight. Have you ever fainted or almost fainted while giving blood? No. How would you describe your body type? More of an apple. I gain weight around my middle. More of a pear. I gain weight on my hips and thighs. I said apple. I gain it in my stomach. How often did you wet the bed as a child? I think I rarely wet the bed as a child. I think I wet the bed like maybe one time. How many colds did you get over the last year? Do not include bouts of the flu. Maybe one or two. Have you ever had plantar fasciitis? No. How frequently do you have difficulty remembering and recognizing people's faces? All the time. Have any of your grandparents, parents, brothers, sisters, aunts, or uncles ever been diagnosed with mild cognitive impairment? No, I don't know. Do you experience frequent or prolonged ringing in the ears? No. Next is about cholesterol. When was your most recent cholesterol measurement? Within the last year. What was the most recent? I don't know because I haven't gotten my cholesterol reading, so I'm not sure. What was the most recent? I don't know. I'm not sure. What was the most recent triglyceride? I'm not sure because I go to the doctor on the 24th. When was your highest ever cholesterol measurement? What was the highest? I'm just guessing because I don't know. What was your highest LDL, the bad cholesterol? I guess I'll do that. It's kind of hard when you don't have your test result things here. What was your highest? The medications I take is Lipitor. Did you have a history of muscle problems before taking? No. Were you diagnosed with diabetes after taking statin medications? No. Are you currently taking Lipitor? Yes. For how long have you been taking Lipitor? 1 to 5 years. How old is Lipitor? Okay, my foot is going to sleep. Are you taking a different dose of Lipitor? My dose is lower. What side effects? None. You've answered more questions than 64% of 23andMe. Who has taken 22% of European people take statins. During a typical week, how often do you eat breakfast? I rarely eat breakfast because, I don't know. Does the sound of other people chewing fill your rage? No. Have you ever been diagnosed with TMJ? No. Do you currently suffer from chronic constipation, fewer than 3 bowel movements per week? No. Have you ever been diagnosed with an ACL tear? No. Have you ever been diagnosed with dyslexia? No. How would you rate your current ability to smell? Good. In a typical week, how often do you eat leafy green vegetables such as lettuce, spinach, or kale? Not at all, because I don't eat salads or anything like that. Have you ever been diagnosed with elbow tendonitis? No. Okay, guys. Next is headache and migraine. How many more questions do I have to answer? I've been on here almost 2 hours answering questions. This is crazy. Have you experienced 5 or more headaches? Yes. Over the last year, how many frequently have you gotten headaches or migraine attacks? Few times. During the past 3 months, did you have severe headaches or migraines? Yes. During the past 3 months, how many headaches or migraine attacks have you had? I think 2. How long do your headaches and migraines typically last? Depends. Sometimes 4 to 6 hours. During or preceding your headaches or migraine attacks, how often is your pain worse or just one side? Is your pain worse on just one side? Okay. During or preceding your headaches or migraine attacks, how often is your pain worse on one side? Is your pain pounding? Yes. Is your pain moderate or severe? Is your pain made worse by physical activity or movement such as walking or climbing stairs? Do you feel nauseated? Yes, I always feel sick, like I will throw up. Do you see spots, stars, zigzags, lines for several minutes? It's less than half time. Does sound bother you? Yes. Does light bother you compared to when you are well? Do unpleasant odors bother you compared when? Yes. Are you unable to work or perform your usual day? Yes. Do you experience numbness or tingling on one side of your body that goes away once your headache is gone? Never. Do Do you experience weakness in one side of your body that goes? No. Do you experience a temporary loss of vision? No. Do you experience a blurring your vision? No. Do you have trouble speaking? No. Do you experience simply? No. I know what they're doing. They're trying to find out if you have a high risk of stroke. Do you feel dizzy? Rarely. Do you see double? No. Do you hear ringing ears? No. Does it become harder for you to hear? No. Do you have poor? No. Have any of your headaches or migraines attacks ever been occupied by seizures or a loss of consciousness? No. Have there been times when you have seen spots, stars, zigzag lines, static or gray areas, and these visual disturbances have lasted for several minutes to an hour but are not followed by a headache? No. Have you ever temporarily experienced partial or full loss of vision or blurred vision that lasted for several minutes to an hour but not followed by a headache? No. Ugh. Has a doctor or other medical professional ever diagnosed you with a migraine? Yes. Who diagnosed you with a migraine? A neurologist. Please indicate below whether any of these biological relatives has a history of migraines, attacks, or headaches of severity. Mother, she has migraines. Father, I don't know. Full sibling, I don't know. Half sibling, I do not know. Mother's father, I don't know. Father's father, I have no clue. Cousin on father's side, I don't know. I don't know. I don't know. It's asking me all these questions, okay? Have you ever taken any of the following medications when you experience? No. Okay. Have you ever taken any of these triptan for your headaches or migraine attacks? No. It says, okay guys, I'm going to stop the video right now and answer some of these questions, but come back and do another live stream because this, not live stream, I mean just a recorded video, because right now it's at 2 hours and I'll have to split up this video. So you know what, I'll just keep on going. It says, when taking soon after the onset of symptoms, How often does an opiate help relieve? When taking soon after the symptoms. Do you have any other medications? No. Prior to onset of a headache or migraine attack, do you typically experience any of the following? Are you currently using a form of hormonal birth control? No. Are you currently pregnant? No. Do any of the following things seem to trigger your headaches and migraines? Is there anything else you would like to tell us about that triggers your headaches or migraines? This is taking forever. You've answered all these questions. Okay, guys. When living in a climate that does not get much sunlight in the winter, do you tend to become depressed during the winter? How often do you feel sleepy during the daytime? Have any of your brothers, sisters, children, or parents been diagnosed with hypertrophic cardiomyopathy or sudden cardiac arrest? No. Have any of your first degree biological relatives, parents, children, siblings been diagnosed with type 2 diabetes? No. Has your biological mother ever been diagnosed with clinical depression? No. Are you currently taking any medications to lower or control your blood sugar? Yes. Do you currently take medication for hypothyroidism levels? No. Have you ever sprained your ankle? Yes. Have you ever experienced nausea or vomiting after a surgery involving general anesthesia? No. And it just keeps on going. Over the last 2 weeks, I was worried about situations in which I might panic and make a fool of myself. Did not apply to me. Over the last 2 weeks, I felt I was close to panic. Over the last 2 weeks, I felt scared without good reason. Over the last 2 weeks, I was aware of the action of my heart and the absence of physical exertion. For example, sensing a heart rate increase, your heart missing a beat. Over the last 2 weeks, I experienced breathing difficulties, for example. Last 2 weeks, how often have you been bothered by having little interest or pleasure in doing things? How often have you been bothered by feeling down and depressed and hopeless? How often have you been bothered by trouble falling or staying asleep? How often have you been bothered by feeling tired or having little energy? How often have you been bothered by feeling bad about yourself or that you're a failure? How often have you been bothered by trouble concentrating on things such as reading? Over the last 2 weeks, how often have you been bothered by moving or speaking? How difficult have these problems made it for you to do your work, take care of things at home? Okay, guys. So this is going to be continued, me answering questions and stuff. But I'm going to do this now and finish answering these questions because it's going to take me like forever. So you take this and it says there's a fill line where you have to spit. And it says no food or drink for 30 minutes, which I haven't had any. Spit to the fill line, close funnel, detach funnel screw cap. And then you seal it in the bag. And I believe you seal this back up and then you mail it. And here's like the little biohazard bag thingy. And the little cap to this is right here. Okay. So we're going to spit. And this will be closed because I'm going to be spitting. It's going to be hard because my mouth is dry. See, you can see it. It's starting. I have to fill it up here. It's just like a little bit of spit. It's not like this whole thing it needs to be filled. It's just a little bit. And it goes up. It's about like that much. course, my foot's going to sleep. Man, my mouth is like so dry. It's getting there. My spit is like right there, and I just need to fill it up there. This is gonna be fun. I can't wait to get the results. It's getting there. See, you can see it. It's like right there. I just got a little bit more. And I may get the Ancestry one. That's from Ancestry.com. And do that. It's getting there. Man. I got it. If your mouth is dry, you wouldn't be able to do this. Almost. Almost. In your saliva, you can learn a lot about it, like. Sorry, guys. It's filling up. I'm going to do one more time. Because they said if it's foamy, you have to kind of go a little bit above the line. I want to make sure I'm getting it good. Okay. So then you close this. What is that? Is that the... Hold on. Okay. Then you take it, you close the funnel, and there's some water in this, or some solution. And you closed it, and the solution got in there. So then you take it, you unscrew it, and then you take this lid and you put it on it, and then this is the solution that's in it, so then it's going to look like that. And then it's a sealing bag. And then you put it back in here and you mail it. Place the tube with small cap and bag. Okay. So you take the bag. And I had to rewrite this. Let me go get a pen so I can write that number down. For what? Take my identity for what? I didn't show him anything. And we stick it in the bag. Just nice and then you take this and you undo it. And then you seal it up. And then I don't know if I should stick it back in here. We'll stick it back in here. Place it in the box. Then we're going to seal it back up. It's like a little sticker here. Place the cap tube into the plastic bag containing the absorbent pad and seal it. Do not remove this. Okay. I'm just making sure. And then you just close it up. So it's all closed up. And then I mail this to, I guess I mail it through the post office. So yeah, so that's about all that you do. And I am going to finish answering these questions. Thank you for watching my video. That's like 2 hours and 30 minutes long. But that is how you do it. And I'm still answering questions. So it takes you a while to answer questions and stuff like that. So thank you for joining. I love you guys and talk to you later. Bye.